Okay, well let's expand our horizons here to the rest of the face. At what age do you see people starting to say, "I think I need a facelift"?
If you're looking at a bell curve, probably 50 to 60 is when people start really noticing. And by 65, a lot of those folks have said, okay, it's now or, not now or never, but I've been thinking about it. I'm ready. It's time. I've got time in my life and what have you. But there are folks that come in even as early as their 40s that have had some skin changes, particularly in the neck area is where we tend to see things start presenting earliest. The neck skin is challenging, it's thin, we move our heads a lot, and we can't be as aggressive with non-invasive treatments like lasers and peels on the neck as we can on the face. The neck skin just doesn't heal quite the same way. And so we're a little more limited as to how sort of aggressive we can be in those neck treatments. And so we end up with that being what sort of tends to be the first thing that folks notice, and then often some heaviness around the jawline or the dreaded jowls start to show up, and that's where folks often are starting to come in and just say they notice they feel like their face is slid or has dropped or all of those kinds of things.
And so, what are the options that we have when we reach that point? Can you kind of walk us through all those choices?
So occasionally folks, if their face is really well maintained and they just have sort of neck skin laxity, there are some things that can be done that are non-surgical, like radiofrequency microneedling or some things like that. There are some laser treatments that can help with discoloration or what have you of the skin. But once that skin reaches a certain degree of laxity, occasionally folks are candidates for neck lifts alone. And so, but I'm pretty selective with that group because oftentimes if you do a neck lift on somebody where their lower face or their jawline is starting to get heavy and their jowls are starting to show up, if you do just a neck lift, the jowl line or the jawline is really not addressed. And so then they feel like they sort of missed an opportunity to just take care of it all at the same time. And so they are not as happy as they think that neck skin is all that bugs them. But in reality, that the other stuff is there too. And you really see it if you don't take care of it at the same time. So there are cases where a neck lift is an option. It's usually in a younger patient, but that would be a surgical option. As far as for the face, as the cheeks sort of lose volume or the volume starts to drift down, the jawline becomes heavy, what have you, then it's a facelift. And I tend to tell everybody that a facelift basically works from the cheekbones down to the neck. It includes the neck lift component, and it allows me to sort of get some of that weight off of the jawline, reposition sort of fat pockets that may have slid forward on the cheeks and down around the corners of the mouth and on the jawline and what have you, and pull those back up to a more youthful position, tighten everything up. And then I just sort of sweep out the extra skin. That's a facelift. And it's amazingly not particularly painful. It's just emotional to have your face operated on. And so it takes, a couple weeks before you feel like you're presentable. And, a lot of times people are doing a little bit of computer stuff from home or what have you after a week because they feel well, but they're just not quite ready to maybe show themselves. But even so, you see the results the day after when the bandage comes off. You can see a change, and it's really impressive.
Is there anything non-surgical that improves the neck that you know of?
Yeah, so there are some things that we can get rid of little fatty pockets under the chin that are non-surgical. In our office, we utilize Kybella and CoolSculpting as ways to remove fat. The Kybella is a series of injections or sort of a grid of injections of a medication that dissolves the fat in that pocket. And then CoolSculpting has a little attachment head that sort of chills the skin and fat in that area, and it causes the cell membranes to alter, and eventually the body will kind of break down those little fat cells over the course of a couple months. Both treatment options take a couple months to see the full results. Sometimes people need a couple of treatments. I'd say often people need a couple of rounds of either of those treatments, but they're both generally effective against fat. They don't do a lot for skin. And so that's where, from non-surgical standpoint, things like radiofrequency microneedling, certain laser treatments can be used to sort of refresh the skin if that's the issue.
Links to our guest's website and contact info are in your show notes. Follow us on Instagram at Where Before Meets After. Where Before Meets After is a production of The Axis, the podcast agency for aesthetics. THEAXIS.io.